Evaluation of BC Cancer Cervix Screening Program. Public health issue, this evaluation will address is cervical cancer. It is the 9th most common cancer among women in British Columbia, and preventative screening can facilitate early detection, diagnosis, treat, and prevent premature death. Early detection can prevent 70% of cases from developing into cancer. The program objective is to reduce morbidity and mortality of cervical cancer. This is achieved by finding precancers and cancers at an early stage through routine screening practices and follow-up of abnormal Pap test results. Both a program and health service run by BC Cancer Agency as part of PHSA serves people with a cervix between the age of 25 to 69. Identify, invite, and screen target populations, investigate abnormalities, and send reminders at appropriate screening intervals. Follow-up data is lacking for 15% of people with abnormal Pap test results. This population is at highest risk of developing cervical cancer. Given the above, this evaluation will look at what socio-demographic factors are overrepresented and lost to follow-up. The health belief model is used to help inform the program evaluation. Understanding perceived barriers and susceptibility for screening follow-up is essential to identify and target interventions to increase uptake in participants who are lost to follow-up after abnormal screening result. The study will identify patients through the CCSP database and compare socio-demographic factors between two groups. The interest group are those who did not follow up after an abnormal Pap test result. This group is compared to those who did follow up after abnormal Pap test results. Data will first be collected through the CCSP database to identify study participants and collect available socio-demographic data, including age, health authority, test results, and program compliance. Data will be collected through a questionnaire distributed to a random sample of participants who have had an abnormal Pap test result. It is adapted from a questionnaire measuring barriers to follow-up for abnormal breast cancer results. Questionnaires will provide additional socio-demographic data not collected through the CCSP and help understand barriers to follow-up. Postal code conversion file will be used to measure access to health service. It will establish if participants live in a rural or urban center and calculate the average distance in kilometers to follow-up screening facilities. Physical tests will be run to identify and determine variables that differ between groups. For example, do participants who do not follow up after an abnormal Pap test result have different levels of education compared to those who do follow up? Recall bias. Because the study looks backwards in time, participants might not remember details accurately. To mitigate this, data will be cross-referenced with the CCSP database. Respondent rate. Those who did not follow up with test results may be less likely to answer surveys. To encourage participation, lottery incentives will be offered to respondents. Participants will be made aware that participation is voluntary and survey results will be confidential with personal identifying features removed. Obtaining patient records for program evaluation is allowed under the Data Management and Stewardship branch of the Ministry of Health. The evaluation will be used to identify program weaknesses. This will be achieved by using data collected during the evaluation to identify which populations are overrepresented in loss to follow-up after abnormal Pap tests. This is important because this group is at highest risk of developing cervical cancer. Identifying these populations can help inform what interventions, resource allocations, and barriers, whether cultural barriers, service barriers, or resource barriers, need targeting. This will ultimately lead to improved program compliance, help provide better patient care, and reduce morbidity and mortality in this population. In conclusion, we hope the program evaluation will be informative for the BC Cancer Service Screening Program, healthcare providers, and eligible participants.